Good afternoon, class. Today we'll be discussing the value of having a resource guide. The resource guide that we'll be talking about today is on maltreatment and military families, and looking at deployment and how that affects military families. So this resource guide will help you have the resources that you need at your fingertips when you're working with military families. We will review the key findings on maltreatment with military families that have experienced deployment in research, and then we'll end with any questions, clarifications, or comments that you might have today. So to begin, the value of a completed resource guide. What do you think the value of a completed resource guide would be for a clinician to have? So let's start by taking a look at a little bit of the process behind how researchers obtain information on a topic. So researchers start by compiling a literature review when they're looking to find out information on a topic that is interesting to study. As the researchers compile the literature, they examine the literature to determine if there are questions that need to be answered or where any gaps in the literature might be. The resource guide takes all the literature that was reviewed on maltreatment, childhood maltreatment, and intimate partner violence in military families that have experienced deployment. The resource guide will have a table of contents, a list of assessments and how to use those assessments, what interventions might go with each assessment, and links to all of the assessments. All of these parts will help make the resource guide user-friendly for you. And then you can use this resource guide as a go-to guide when you're quickly looking for an assessment that would be helpful in the clinical setting and working with military families that either have reported or they're suspected maltreatment issues and they have experienced deployment. So some of the key findings that were found on maltreatment with military families and deployment, some of those are, while each study is done a little bit differently, it was clear across all the studies that deployment does have some effect on military families throughout the cycle of deployment. There are a number of key findings in the research. The first would be the importance of clinicians being aware of and assessing for severity and risk factors of treatment. There's also being aware of the relationship satisfaction with military families, assessing for symptoms of depression, trauma, and or behavioral problems with family members, especially behavioral problems with children. The effects of the deployments, and also the importance of the clinician knowing what resources are available to military families for support and intervention. We'll go into a little bit more detail on each of the key findings. So for the first finding, when looking at the key findings of clinicians being aware and assessing for the severity and risk for maltreatment, different studies had different findings based on exactly what they were looking for. According to Thompson et al., they reported there was a lower frequency of child maltreatment with regards to emotional abuse post-deployment. However, the severity of maltreatment varied when they were looking at pre-deployment versus post-deployment for other types of maltreatment. So if the severity of the maltreatment is what made the difference there. According to Taylor et al., there was a higher risk for substantiated maltreatment with multiple deployments. And Saltzman et al. Reported that the importance of understanding the risk and resilience process that happens with military families. And the second key finding was looking at the importance of relationship satisfaction with military couples. And Kelly et al. Reported that there was higher levels of relationship satisfaction led to less incidents of maltreatment with regards to intimate partner violence. And this study also found that intervention during pre-deployment stage before they deploy, especially if couples were stressed, can help decrease physical partner violence. The next key finding was on deployment, and Lester et al. Reported that they found that military members and their spouses had, not on deployment, on symptoms. So symptoms of depression and trauma. Lester et al. Reported that they found that military members and their spouses had clinically significant symptoms of depression post-deployment. And the study also reported that family members and children could experience secondary traumatization, and that the children's social and emotional development was found to be associated with parental behavioral health. Therefore, if the parents were having a hard time with their behavioral health, then it might also affect the social and emotional development of children. The fourth key finding was regarding the effects of deployment. The effects of deployment on military families was found throughout the studies and related to maltreatment of military family members within the studies. For example, McCarthy et al. Reported higher rates of child maltreatment while the active duty parent was deployed. Another study, Thompson et al. Reported that maltreatment varied pre-deployment and post-deployment depending on the severity of the maltreatment, as we talked about before. Taylor et al. Reported that the highest risk for maltreatment could be within the first 6 months post-deployment. And the final finding regarding the effects of deployment would be that deploying fathers had higher maltreatment rates than deploying mothers did. And that may just have to do with the fact that more men deploy than women overall. So the last key finding was the importance of clinicians knowing resources that are available to military families for support and or interventions. Taylor et al. Reported that the military offers programs to help military families with adjustment throughout all phases of deployment. It would be important for clinicians to be aware of what those programs are and how to get military families involved with those programs. Walwinski et al. Reported the importance of clinicians having a good understanding of the family systems and deployments to best be able to help military families. The study also discussed the importance of having collaborative relationships, knowing about community supports, and using school counselors to help military children. All of these areas would be important to be aware of as clinicians in order to help military families get the support they need. So in your resource guide that you'll be getting today, you will have all of those things at the tips of your fingers. And when you're in sessions with military families, you'll be able to pull them out and help you find the information you need easily. Is there any questions, clarifications needed, or comments of anybody today? And don't forget to pick up your resource guide.